September is a month dedicated to raising awareness for a disease that will impact 1 in 8 men in their lifetime. Prostate cancer stats can be frightening, but advancements in diagnosis and treatment are providing new hope. And joining us to discuss the importance of early detection and the latest in treatment for prostate cancer, we've got the medical director of BAMF Health, Dr. Brandon Mancini. Good morning, doctor.
Good morning.
Thanks for being. Oh, I'm so glad you're here. Let's talk about the why. I mean, 1 in 8 might be a reason enough, but why is it so important to get this conversation to the national forefront?
Yeah, I mean, prostate cancer, not only 1 in 8, but it is the most diagnosed cancer in men. And so understanding that and the fact that early detection saves lives, it's important to open up this conversation.
Absolutely. So I mean, you just said it, 1 in 8 and the most diagnosed cancer in men. So if you're a dude, pay attention to prostate cancer, especially with those screenings and those treatments. And boy, talk about treatments. You guys are on the cutting edge.
Absolutely. Yeah, there's been a ton of advancements over the last couple of years where treatments are getting more precise, more specific, and just added treatments to what tools we've had historically, which is extending quality and quantity of life for gentlemen anywhere from many months to many years, where again, this therapy did not exist a couple of years ago. And so that's very important for people when they're going through this journey. That's
very important to hear that this didn't even exist a couple of years ago. So you want to pay attention to what's happening. Chemotherapy, that's a lot of the reason why that quality of life suffers.
Sure.
What is this radiopharmaceutical? Something that goes maybe before chemo?
Yeah, so really radiopharmaceutical therapy is a targeted medicine. And so it's injectable or infusion just like chemotherapy, but when that medicine enters the bloodstream, it goes and seeks out the prostate cancer cells themselves, attaches to those prostate cancer cells, and literally delivers direct radiation therapy within about 1 millimeter of where it's sitting. And it really leaves the rest of the tissues alone. And so when you're delivering targeted aggressive therapy locally at the tumor level, and it's not going to impact the rest of our body very much, then there goes your quality and quantity of life up significantly. People are receiving these treatments. They're playing pickleball and golf and gardening and all these things the next day. And so it's remarkable. It's a huge advancement in medicine.
I think what you're saying almost sounds miraculous. Well, I mean, that's kind of the unicorn that everyone's been chasing, right? To be able to treat only the diseased cells.
Absolutely. I feel like every 5 to 10 years there's a big innovative or emergent type therapy. And we're very lucky in prostate cancer that this major leap just occurred about 3 years ago. And to your point, now with the advancement to be able to deliver this before chemotherapy, again, it comes down to that quality and quantity of life. And to be able to utilize this treatment earlier in the disease status gives us better outcomes, gives us longer quality and quantity, and helps so many people each and every day.
Yeah, this is exciting news. And other services too, PSMA PET scan. You're going to have to break all those letters down for me, doctor.
Yeah, so PSMA stands for prostate-specific membrane antigen.
Got it.
And it's literally a protein that's overexpressed on prostate cancer compared to the rest of our body. And these PET scans have been around for about 4 to 5 years, but we're seeing things we never saw before. And so it's more accurate diagnosis, it's better, more accurate treatment. And so outcomes will continue to improve because we're doing things better and with more knowledge before we embark on that treatment journey.
And are people getting full body MRIs? Is that happening?
Yeah, absolutely. That's another service at BAMF Health where a lot of individuals kind of that are healthy at baseline want that internal head-to-toe screening.
Right.
And so that's taking place quite frequently.
That's amazing. Yeah, absolutely. I can only imagine. Well, I mean, talk about under the hood. You're looking under the whole car there,
absolutely.
Right?
Yep. No,
so if there's more information, I think we've covered it here. It's important. Men, it's going to hit you, and it's going to be the most common cancer for you. Early detection is available. And now we have all of these great advancements for diagnosis and treatment for quality of life. Well, let's get some information. Let's get men to the doctor. I mean, that's the first step, right?
Absolutely. I think early detection saves lives is the take-home message. And for prostate cancer specifically, it's a blood test that diagnoses the majority of prostate cancer. So it's not very common that symptoms are part of that presentation. It's literally your yearly annual physical with your practitioner, getting that PSA or blood test that looks for this specific biomarker. That's going to collect data and find most of these cancers at an early stage and a very treatable stage. so that it doesn't impact long-term life.
Don't sleep on the doctor, on the annual and that physical and that exam. Make sure you ask your doctor about it and keep that prostate healthy. September 11th, 18th, and 25th, you've got the Health 108 walk. Really quickly, before we let you go, what does that 108 stand for?
So 108 is kind of the play on words of 1 in 8 for the number of men that were affected by prostate cancer. So we're encouraging people either individually or in teams to walk 108 miles for the month of September. So it is getting into the month of September. So yeah, just to kind of get out there, spread awareness, do something healthy with friends and family, honor or memorialize people that may be affected by prostate cancer, and get out there and spread that word.
We'll definitely want to invite everyone out to that. BAMFhealth.com if you want more information. And boy, we're excited about the advancements in the treatments that you have for prostate cancer. You're going to want to look into this. BAMFhealth.com for more. We'll be right back.